Usually what ends up happening is I end up creating the video and then taking the audio and downloading it and making it into the podcast, et cetera, for basically a simulcast. Today, I'm going to flip it on its head. So we're going to have two segments. First segment is going to be a recording of a radio interview that I had on KGO radio in San Francisco, California. That happened this past weekend. It was on something called The Consumer Show. Shout out to Michael Finney. Very nice guest. I guess I'm the guest, right? Very good interviewer. Very nice man. You can hear that we got along straight away for the very short period. And then I'm going to talk about all of these other types of, insurance type policies that kind of get put in front of me to put in front of you and how I look at them. That means what? Indemnity, hospital indemnity, critical illness, all of those things are supposed to sit, either short-term medical. All of these things are supposed to sit as, I just swore, didn't I? Alternatives to the Affordable Care Act compliant plans. The math of that also now has to be reconsidered. I thought to release a much kinder, gentler, nicer version of the Much More Than Medicare Weekly. But then I'd be glossing over vital facts important for people to make when understanding financial contracts and choosing amongst the many different options. Hard pass on all that. Let's get started.
Welcome back, everyone. I'm Michael Finney. This is Consumer Talk on KGO. Our telephone number is 808-0810 if you feel like making that phone call. You can call about anything you're hearing on the show or if you have a consumer question or problem of your own. On the live line right now, we have J.O., Managing Principal of GH2 Benefits. He's here to talk about how to reduce health insurance premiums, even down to zero. Jay, I appreciate you joining us today. Thank you very much.
Thank you for having me, Michael.
First of all, tell us, what is GH2 Benefits?
Well, GH2 Benefits is a financial planning firm as well as an insurance brokerage. We have clients nationwide from Miami to San Francisco to Hawaii.
Excellent. So you help people protect themselves, pretty much is what it comes down to. And let's talk about health insurance premiums. There's a lot of money floating around and people aren't using it. Do I have that right?
You've got it exactly right, Michael. I mean, even persons that already have health insurance, they may receive already the advanced premium tax credit, which is a subsidy. It's complicated because it is a tax credit, but they have been greatly expanded over the last month. To give you an idea of the number of people, it's almost an extra 1 million people who had health insurance in the past have gotten it at tremendous discounts for persons prior to Medicare. That can be 70 to 100%. That is absolutely possible. It does depend on your combination of household size and taxable income.
So is this, because you said it's complicated because you do receive it as a tax credit.
That's right.
So it's not like signing up for Obamacare here in California. You sign up with Covered California, which is coveredca.org, I think, .com. And but it's not like signing up for that, or how do you do it? Let me just start. How do you qualify for zero premium plans?
Well, you do have it right, which is that Coverage CA is basically Affordable Care Act insurance. It now has this subsidy. As a result, you can go there and you update your plan if you have insurance already. If you do not have insurance and you live in California, that is the place. For persons in other locations around the country, That is healthcare.org. Sorry, healthcare.gov.
And by the way, it's coveredca.com. So that's your starting point. Am I right?
That is correct.
Here,
and from there, you have.
Pardon me.
What I'm saying is that every state has either the state site, like California, or you can go to the federal government site, healthcare.gov. And from there, you can get a very good estimate based on your household size, your taxable income, on how much this tax credit would be. And therefore, you would get a resulting discount and then a final price to the consumer. So those are the steps you have to take. I would just say, as I said, I don't mean to be negative, which is that people misunderstand that this is a tax credit. That means that every input, everything that you consider as taxable income has to be reported. You can presume that, we get contacted by accountants and lawyers and all sorts of other professionals. We've seen some pretty large errors. Those can be costly. Nevertheless, the discount's so large and new and important, especially in the age of a pandemic.
So before we were talking about, not extreme, but limited incomes. This, because of the pandemic and the new rules and new programs, those with higher income are qualifying. Am I right about that?
You're spot on, Michael, which is exactly right, which is that part of these changes, these new changes, what they do is they enhance the amount of the subsidy. In addition to that, they also increase the range of incomes, and you can still qualify for these tax credits. And so what has happened, especially persons who are in the years prior to Medicare, high 50s to 64.9, this is really the sweet spot. It has dominated our attention over the past month.
Wow. So you're learning as you go along, huh, Jay?
We knew that, I'd been spoken in public a large number of times about a lot of different topics. One topic I know a great deal about is I'm the published author of a book on Medicare called Maximize Your Medicare. So all of this, it is the normal process for us to help persons prior to Medicare as they're setting up their retirement plans, understanding how that works, and then, of course, how they're going to transition from where they are. Let's just say they're 63 for those 2 years coming into becoming Medicare eligible. That's the normal process over here, Michael.
So how do we all figure out how big a benefit that we're going to qualify for? Is there a way to do that?
On both covered CA as well as healthcare.gov, there are estimators for this. In addition to that, they can go to my firm's website, our firm's website, gh2benefits.com. Also, pretty easy to do that on a computer or on your mobile phone. In fact, I made a TikTok video where to show someone the simple steps. The reality is, even younger persons, 28, you can remember your 28-year-old self. You're in perfect health. You never go to the doctor. But if you can drive premium down to zero, very much worth it because of the fact that it still has this layer of protection just in case.
Got it. No, I was just having this conversation with a family member saying, okay, why are you not doing this?
I know. Right, exactly. It is difficult. I realize people think that it's too costly as a result, and, I'm perfectly healthy. But that may have been true at many hundreds of dollars a month. It didn't fit a person's budget. However, as a result of these changes, that is no longer the case. Definitely worth a look.
So let's talk about those that were on COBRA, because this program wasn't available. Not all the programs were available. COBRA, people love the coverage, hate the cost, tends to be very expensive. Anything for them, or do they quit Cobra and sign up for one of these programs?
So you've touched on a number of different topics, whether you meant to or not.
Go through them, baby.
So I totally agree with you. Cobra generally, prior to these latest changes, is just code for massively expensive, but accessible because the employer was required. Now, however,
Right.
if you are on Cobra as a result of a reduction in hours or involuntary unemployment, company pays Cobra in full through the end of September. This is brand new. So new, in fact, that most of the persons that we attempt to help on this, they go to their employer. The employers are not fully educated on it.
Wow.
But it's there. In addition to that, the date that you were first on Cobra has been backdated to the past. So this is very valuable. And when Cobra ends at the end of September, let's just say you're 62, you still have the right to enroll in the Affordable Care Act, whether that be covered CA or on healthcare.gov. Tremendous value here for persons on Cobra, especially about these little known clauses. And when I call things complicated, what I really mean is that the rules are very clear if you understand them correctly. But once you do, then the consumer does have a great deal of control here. That's always been the case. It's just been that people have misunderstood the rules, or they get flustered or afraid, and then they stop looking. But the reality is rules in the consumer's favor. Just as in Medicare, crazy people write books to tell them
that. Like you.
Yeah, exactly.
It's interesting, Jay. I know what you're saying, which is people are used to having their employer deal with this. And so they go through life and they take what their employer gets them. They look for employers that they know offer good benefits, which include their medical care. But now all of a sudden they're out there and they feel ill prepared. It is overwhelming. Just Medicare, point A, the A, the B, the D, or maybe you're going to, it's like, what a mess it is. But it sounds more complicated than it is. Isn't that what you're really saying?
It really is true, Michael. And, we veered off first on pre-Medicare. The subsidies, the tax credit have been expanded. So
Right.
Persons who believed that they didn't qualify, they should at least, it just makes common sense. I'm not trying to split atoms for people. I'm just trying to communicate to them very clearly that these premium subsidies have been expanded tremendously. In Florida, we're talking about persons that the financial value here can be $10,000 a year per person if you're 63. That is absolutely a result that I've seen that we've helped.
Yeah, that is stunning. J.O. is who we're talking with. You can find his book on Amazon. I know because I just did it while we were talking. It's called Maximize Your Medicare. It's cheap. It's $12.99. If you're looking at Medicare, maybe something you want to do. And Jay, I've got to thank you. I love how you just wrapped up the conversation by just saying pre-Medicare. That's a good way to think about it. And here's what it is you do. J.O., I appreciate your time today.
My privilege, Michael. Thanks for having me.
Thank you very much. We're so lucky that we have guys like this out there that actually understand all of this stuff. Okay, when we come back, 4 ways to use your mobile wallets. We're getting that from Kiplinger's. They're pretty smart folks over there, too. So hang around.
So the reality is that, I kind of run a used car store. Used car dealership. There you go. Well, and you can understand why I hesitate to use that analogy because that makes me a used car salesman, which I don't really love. But anyway, let's say you come into my used car dealership. You say, Jay, I want a sports car. I say, dude, You live in a town of 500 people. There's one paved road. And oh yeah, by the way, that road has lots of potholes on it. How about a pickup truck? He says, no, I want a used car. I want a used car, but I want it to be a sports car. I'm having a midlife crisis. I go, okay, yeah, but, and then I go describe what's actually going on. In the same way, Bidencare has actually changed the landscape of the town and the roads. Okay, so basically what has happened here, as a result of the advanced premium tax credit, in other words, the health insurance subsidy, it has lowered the sticker price of health insurance notably. Many of our clients are experiencing this. 70, 80, 90%, 100% lower, literally health insurance for zero. And that can be gotten, right? I don't control the price because I know that there's a market. Those markets have list prices. I know what they are. Well, let's just take a look at what that you do when you're comparing cars. I already know that the health insurance plans under the marketplace, whether that be healthcare.gov or your state-specific exchange, it's got a certain set of what I'll call safety features. In insurance talk, those are called essential health benefits. It's a list. Like what? Well, preventative screenings. Your annual screening to your primary care physician, for example. Those are part of, embedded inside every compliant plan. You can't list on those exchanges if you don't comply. However, the sports car, those same rules don't apply. And now you can understand my point, right? Which is that, yeah, I can understand having a car is better than not having a car. Fine. Having some type of transport is better. That I could understand. But now look what has happened. Now what has happened is because the price of the compliant plans has declined to this degree, now all of a sudden the comparisons have to be different. Just the other day, we've got a real life example, which is a person calls and, highly educated, better at math than I. He says, Jay, I'll take a look at these compliant plans, but please know that I have also these other ancillary plans, standalone plans, okay, which in that particular case pays indemnity, which means that they write you a check if something happens. Okay, and there's no disputing that, let's just say for the moment, let's not dispute the fact that that company would stand up to the contract. I'm not doubting that. I'm not saying that they will not. Okay? Nevertheless, the fact is it doesn't have these built-in safety features. It doesn't. Okay? That's number one. That's very important, right? Because this sports car, this indemnity plan, right? It does do its job in that situation. It just doesn't do the complete job that a compliant plan will do. There's a second very, very important feature here, which is this over here. It has a limit on your out-of-pocket expenses, meaning that once you hit that limit, your bill then becomes zero. Over here, these indemnity plans, they don't have this. If you go to the urologist, if you go to your oncologist and you get the news that you do not want to hear, what will happen is they'll pay you up to X, but there will be a limit on the amount of money that you can collect. Over here, if the bill is at $3 billion, you have an out-of-pocket maximum, and from there, your bill is zero. It's very important here because now all of a sudden, as a result of the fact that these cars over here, the price has declined, now the comparison between these two is way different. Way different. What are other kinds of transport over here? What's the bicycle, sports car, whatever, go-kart? What are they? Critical illness, ones that give you a cash amount, for example, if you have cancer, stroke, heart attack. Like I said, indemnity plans. That's another example. What's another example? Health sharing. All of these three, those are examples. There'll be more, which is short-term. Very important, short-term health insurance, right? These four will all have their role at a particular price. But now all of a sudden, as a result of Bidencare, the American Rescue Plan Act, the price comparison exercise is entirely different. Ultimately, like I said, I run a used car dealership. You come and say, look, I still want a sports car. You get a sports car. We've got them. I will find you the best of class of these sports cars. Of the sports car, go-kart, bicycle, whatever it would be. That I will do, of course. But nevertheless, what I'll be first saying is let's now take a very close look at the price of these two groups compared to each other, and how valuable these safety features inside a compliant plan, inside of every Affordable Care Act compliant health insurance policy brings. The same thing can kind of be said when it comes to people with Medicare, and most specifically Medicare Advantage. So I look at my email, in my inbox are thousands of unread emails. Not really, but you can understand I got tons of advertisements from different carriers and different parties saying, hey, look at this hospital indemnity. So the way hospital indemnity works, that if you are inpatient hospitalized, you get a check. This money can be used to defray the Medicare Advantage inpatient hospitalization copay. Generally speaking, let's just call it $250 a day for 7 days. That's kind of a generic, set of language that is included inside of a Medicare Advantage plan. Well, if that were to occur, you get a check for whatever your particular language says, X dollars for Y number of days. That's the way that hospital indemnity works. And to some, that can sound like a good idea. Now, the reason for this part of the segment that I need to tail off here, because it also dovetails to where I could have been wrong just a few moments ago, which is this money can be used for any reason. In other words, if you get a check, and let's just call it the check was $100 a day. Well, no one said that you actually have to use that $100 a day for the direct inpatient hospitalization. For example, if you had to travel and your spouse needed to stay in a hotel, etc., it can be used for whatever purpose. Money is fungible. That's the technical term. So that is a particular place where you can see that the money could be useful. I get all that. That said, you have to pay for it, right? I mean, you're not paying this for zero. They're asking you for a premium along the way. In addition to that, it's not as if you can go to the oncologist or to your urologist, get your bad news, and then call me to get one of these policies. That will not work because there's going to be an underwriting standard of pre-existing condition. Remember that I told you that the sports car, bicycle, go-kart, whatever it would be, they're not up with the same set of rules as over here, which were the compliant plans or Medicare Advantage. There's no underwriting over here. They're The language is different. There can be underwriting over here. Right? They're not the same thing. Just a word to the wise. So I see this because I know, what these emails are sent to me for is to encourage me to, publicize this and how great the fit is and all that kind of good stuff. And ultimately, I am running a used car dealership. And yes, if someone wants a sports car, they get a sports car as long as they understand what they're actually buying. By no means do I think this is over. You can understand why I encourage you to like, subscribe, hit the notification bell. I'll give you a couple moments now. 1, 2, 3. Do it. Amen. The real reason is that markets move, right? So I've told you, just like you would when you're shopping for a used car, right? In other words, you go and compare all these different things. What I'm going to say here is, over here, as I've pointed out, there are compliant plans. Medicare Advantage being a compliant plan, absolutely. Medigap, remember there are enrollment rules. Crazy people write books about these rules and to make sure that people have some guidelines on what to do and what not to do. Hint. In addition to that, the thing is that over here, I would absolutely, almost as certain as I'm sitting here, I would absolutely expect the sellers to respond, right? You're talking about competition here. These people over here will know that this is going on over here, which is that as a result of the American Rescue Plan, the prices of individual health insurance, most importantly, has plummeted, such that the sticker price of compliant plans over here is lower than the price of critical illness, short-term indemnity plans. All three. So you can understand that these sellers are going to have to be adjusting. Almost certain. In fact, I've already seen evidence of that. For example, I can see certain short-term plans now extending the life of how long you can be covered by these plans. It used to be depending on, 6 months to a year. I've seen up to 3 years. In other words, you have a market. They're watching each other. I'm watching it for consumers. I'm watching it for you. You can stay up to date here on the channel. I'm giving guideposts, ways to consider so that you can compare these. Note, I didn't say that you can execute these that cleanly, right? Because actually comparing these over here is even more complicated than over here in the individual market, right? Because of these standards, because of these documentation that says if you're a Medicare Advantage plan, you must have an out-of-pocket maximum and its limit is X. In the individual market, you've got the similar type of thing. You have essential health benefits that I spoke about earlier. Over here, you can consider the fact that these bells and whistles, dip switches, if you will, can be adjusted by the sellers. I would absolutely expect them to do so. All right, that's it for today. MaximizeYourMedicare.com is the official website for my book. GH2benefits.com. That's where you can get all your quotes, ideas about other parts of your financial life, all these things I've been talking about today on today's podcast, health insurance, etc., etc. Still the shallow end of the pool. Thanks to KGO Radio and Michael Finney for a very nice interview. I'll be on next week, which is, I think, the 18th on Sirius XM. I think it's, channel 146. Sirius XM, channel 146 at 8 a.m. for about a half an hour. So that's coming up on the 18th. Please be sure to subscribe, rate, and review with a 5-star rating up on Apple Podcasts. Not enough people listen to the podcast? Not really sure why. Well, I do know why, because I got this nasal Midwest voice, but I will absolutely stand behind everything that I said over here today and every day. I'm Jay. Thanks for joining me here on the Much More Than Medicare podcast. Speak with you soon.